Hello, everyone. This is the People City Laboratory, and Evelyn Christini and I, myself, Andrea Pena, will be presenting it to you today. We are a private nonprofit laboratory with a total annual test volume of 80,000, located in Las Vegas, Nevada at 1400 Grand Avenue. Presented on the screen is our CLIA ID number that we have been granted for testing. Our laboratory director is Evelyn Christini, and I am the owner of the laboratory. We have the following units, which are microbiology, diagnostic, immunology, chemistry, and hematology, and our operating hours are Monday through Friday from 7 a.m. to 6 p.m. So our scope of service and population served were inspired from personal experience from working in a laboratory in Washington, D.C., and seeing how many homeless people require resources like clinical testing or better healthcare services. However, these are not available to them. So we wanted to make it our mission to provide high quality testing to low income and homeless populations in the city of Las Vegas and anyone else that needs it for that matter. It's not strictly for these populations, but we wanted to facilitate clinical testing for these populations. Our laboratory personnel would collect and analyze specimens from patients referred for laboratory testing. Our goal is to partner with community clinics around the city, whose goal is to also support low-income and homeless populations, where doctors would be referring their patients to laboratory testing at the People City Laboratory. Moreover, our laboratory serves any patients ranging all the way from neonates, which is less than 1 month old, all the way to geriatric patients, which is above 65 years old.
The mission and vision statement plays a critical role in an organization. It shows the objectives, how the laboratory aspires to go, and it also communicates the purpose of the laboratory. The People City Laboratory's mission is to deliver outstanding patient care through commitment to the community and by providing the highest quality laboratory services which are readily accessible, comprehensive, cost effective, and timely. We aim at making it possible for low income and homeless individuals of the city of Las Vegas to have access to quality laboratory testing to support health and enhance the quality of life. While our vision is to be considered by patients, healthcare providers, colleagues, and the community as the leader in providing quality laboratory services, to create a safe workplace that maximizes staff involvement, encourages team building, and promotes harmony with highly qualified and fully trained employees, and to implement continuous quality improvement and to provide the highest level of operational support to enhance the quality of clinical laboratory testing. People City Laboratory is accredited by the College of American Pathologists, or CAP, under CLIA, or the Clinical Laboratory Improvement Amendments. The laboratory is also regulated by the Nevada Department of Public Health. So why CAP accreditation? CAP is the laboratory accrediting agency of choice nationwide. It is our trusted partner in laboratory accreditation. It does not only support the practice of laboratory medicine, but also the individuals with educational programs, keeping us current with all the development and making sure we are compliant, which means we are running a quality laboratory.
At the People City Laboratory, we have earned the Certificate of Accreditation, which means we're able to do all kinds of testing. However, at the moment, we're only doing moderate and high complexity tests. Within our units, we have the glucose, magnesium, and potassium routine chemistry assays within our chemistry unit. For hematology unit, we have CBC without a differentiation, hemoglobin, and platelet count. For our diagnostics immunology unit, we have the antinuclear antibody screen and treponema pallidum antibodies. And finally, for microbiology, we offer the HPV assay and SARS-CoV-2 assay tests. Starting out with the Hologic Panther system, it supports a broad range of STI, women health, viral load, and respiratory assays. This platform is an integrated testing system that fully automates all aspects of nucleic acid testing. It makes it very easy, all the way from sample processing through amplification, detection, deactivation, and result reporting. It is all automated and it is very user-friendly. In this case, we're using it for the human papillomavirus. Screen assay is a target amplification nucleic acid probe test for the in vitro qualitative detection of the E6 and E7 viral messenger RNA from 14 different types of human papillomaviruses that are considered high risk. And then on the other hand, we have the BioFire film array, which is this is a more compact instrument, but it also simplifies testing with an automated protocol that also integrates sample preparation, amplification, detection, and it also ends with automated analysis of results. All of the reagents are preloaded and freeze-dried in a film array pouch, which it is very easy to use and set up. At the end of the run, the film array software analyzes the run, and assigns a final assay result. For this particular assay, there are 3 targets for SARS-CoV-2, and the film array software does the analysis of those 3 targets. BioFire film array also supports testing for other assays like viruses, bacteria, yeast, and antimicrobial resistant genes. For this SARS-CoV-2 particular assay, it is a multiplex real-time PCR test that is intended for the qualitative detection of nucleic acid from SARS-CoV-2 in nasopharyngeal swabs. In this slide, you can see more instruments that we have at our laboratory. So we have a typical EIA ELISA reader, Cobas D311 analyzer. This one's for our chemistry unit. Then we have the DXH900 hematology analyzer for our hematology unit, and Bioplex 2200 multiplexing platform that is also able to perform different assays within our immunology unit.
This is the People City Laboratory organizational chart. It is important to have a clear overview of the organizational structure within the laboratory. Staff need to understand the relation between quality management, technical operations, support, and other services, and the structural order within the organization. We are a high throughput, moderate, and high complexity lab. The laboratory director is in charge of the entire laboratory. Each position has a core function and responsibilities, and the organizational chart is part of the lab quality manual, accessible to all the staff. This is also submitted to the accrediting agencies such as the College of American Pathologists or CAP.
This slide provides you a quick overview of our training and policies procedures SOP, which describes the process for ensuring adequate training at our laboratory and applies to initial training, retraining, and training upon modifications. First, we have our onboarding training, where you would have to take training courses like bloodborne pathogens, HIPAA, and such. You have policies and procedures, personnel files, vaccination and screening like hepatitis B and tuberculosis, and laboratory safety walkthrough. We also have a mandatory color blindness evaluation since it can affect performance. And then initial instrumentation and procedure training is divided into 3 modules: pre-analytical, analytical, and post-analytical. You have to do hands-on instruments to do these. There has to be proper documentation for all of these where the trainer is evaluating you, like observing you, and also fills out a performance evaluation for you. And all of that is kept in your training documentation. We also talk about other trainings that need to be documented, like vendors coming in and such, and SOPs requiring retraining if there are certain modifications to those, or general retraining if the personnel is not performing our assays as they really should be. Here we provide a quick overview of our continuing education program, or CE program. which provides guidance for the People's City Laboratory. Education is a lifelong process, and it is the responsibility of every clinical laboratory staff member to see opportunities to enhance their knowledge and skills. The CE program is a staff development program aimed at increasing the mastery and understanding of their job as they continuously strive to become more competent, productive, satisfied through a work environment that promotes self-development and learning. Our CE program is offered through Lab CE by Media Lab. Lab CE provides resources such as CE and compliance courses, online tracking and reporting, as well as data backups, data retrieval and downloads, and printable reports. This SOP also mentions other acceptable forms of continuing education, which are like employed offer courses, college coursework, teleconferences, competence assessment by employers, books, master's thesis, and doctoral dissertations, and a few others. This SOP also talks about the requirement for certified personnel that they would need to renew their licenses or certifications, which are outlined by ANSI, American National Standards Institute. This requires the completion of the program every 3 years.
Competency Assessment SOP. It describes the process of assessing and documenting the competency of trained technical laboratory personnel and non-technical personnel of the People City Lab. This procedure applies to all technical laboratory personnel involved in pre-analytical, analytical, and post-analytical production activities at the People City Lab. It also applies to non-technical personnel who are involved in supportive tasks for the laboratory as defined in the document. As mentioned earlier, competency assessment requirements applies to technical and non-technical lab personnel. So who is responsible for performing the competency assessment? The People City Lab is a high complexity testing lab. Therefore, the technical supervisor for high complexity testing is responsible for performing and documenting competency assessments. This responsibility can be delegated in writing to a general supervisor as long as the general supervisor meets the regulatory qualification as a supervisor for high complexity testing. Ultimately, the laboratory director is responsible to ensure that all testing personnel are competent and maintain their competency in order to perform and report accurate and reliable test results. This is an overview of the People City Lab safety policies and records. The safety policy of the People City Lab is to comply with all federal or state laws pertaining to the safety of employees and the elimination of unnecessary safety hazards from the workplace. These policy includes requirements under federal OSHA regulations, regulations issued by federal and state agencies covering hazardous chemicals, and any other substance potentially harmful to employees. The lab director is directed to take the actions necessary to assure that the People City Lab is in compliance with this policy and with all pertinent federal and state regulations. The lab director or a designee is authorized to review and approve plans prior to their implementation to assure compliance with this policy. These laboratory safety plans sets forth policies, procedures, equipment, personal protective equipment, and work practices that are capable of protecting laboratory personnel from the health and safety hazards inherent in laboratories. The primary goal of this plan is to assist in making the laboratory a safer place to work. The secondary goal of this plan is to meet various state and federal regulations.
In this slide, we will tell you about our laboratory information system. We decided to go with SoftLab. This is a platform intended for the use of a broad range of laboratories. In our case, we have our 4 different units. That's why this was important for us to use. It is one of the top softwares used given that it is user-friendly, it has easy navigation, while also being able to maintain top productivity in our laboratory environment. Moreover, it allows for our samples to be easily tracked and managed, and it allows us to personalize our workflows and customize our reporting system. This also can integrate a notification system that allows the users or providers to be aware of the results when they're done. And another huge thing that we wanted to implement was the integration between software and instrumentation and integration amongst other softwares. So in our case, all of our instruments are going to be able to be linked up with this software, meaning that it can provide automated and quick results into our software instead of manual inputting of results, and the software integration of various soft programs such as SoftTotal QC, which can provide inventory of supplies and controls, reagents, media, drugs, panels, and consumables. And this was also important for us since it is a lot to keep track of. So we wanted to make it easier for ourselves. That's why we think that SoftLab was our best option for People's City Laboratory. This slide and the next slide is just to give you a quick overview of what our standing operating procedures look like. We have our heading that remains the same throughout all of our standing operating procedures: principle, clinical significance, specimen information, safety, materials, and standards and controls. Moving on, we have our procedure, which gives you instructions in a stepwise manner. We don't have calculations for this assay. Then we have reporting of results or interpretation of our assay. Then in the last part, we have limitations, references, and our approvals and signatures, which shows that this document or SOP is reviewed every year.